metapneumovirus is a widespread respiratory pathogen that causes respiratory tract related infections, specifically in children who are under the age of 5 years, causing mild upper respiratory infections and also more severe lower respiratory infections such as bronchiolitis and pneumonia. Human metapneumovirus, commonly called as HMPV, in elderly people can also cause hospitalization, pneumonia, and even death. Hi, I'm Dr. Anahita, working as Associate Program Director of Public Health at James Clean Institute, Switzerland. And I'm here today to talk on public health preventions and the precautions that can play an important role in breaking this disease transmission and avoid crisis-like situations worldwide. So preventing this disease transmission, as I mentioned, is crucial. However, there is no specific treatment or antiviral treatment or vaccine available for HMPV. But there are various public health interventions that can help us limit the disease severity and its transmission. Firstly, given that since this disease most commonly affects children who are under the age of 5 years, so we can say these children under the age of 5 years are at a higher risk or at a significant risk of developing severe HMPV disease. So we need more effective preventive measures targeted specifically for these children, and these measures should be implemented at different levels, we can say. For example, at local level, these measures should be implemented in daycare centers, preschools, and even pediatric units in hospitals and other healthcare facilities. And this can help us limit the exposure of children to all those who have respiratory symptoms and also following good hygiene standards. Secondly, one of the most effective approach is to prevent the spread of the disease is encouraging frequent and thorough hand washing. So basically maintaining good hand hygiene is very important, not just for children, but even for adults, elderly people, and each and every person, regardless of age group. So simply washing hands frequently with soap and water, specifically during peak seasons when there is peak of respiratory infection season. For example, during winters is very important. And in areas where the soap and water is not accessible, then hand sanitizers, simple use of hand sanitizers are an excellent alternative. Third point is about coughing and sneezing. People should cover their, mouth and nose simply with a tissue or a piece of cloth or with their elbow to avoid the transmission of the virus by the respiratory droplet. So it is important to properly dispose of that tissue or the piece of cloth and sanitize the hands or wash of the hands immediately following use. Fourth, regular disinfectant cleaning of within homes. The commonly touched surfaces should be cleaned frequently by the people. For example, the door knobs, the light switches, toys of the children, etc. All these can help us minimize the disease transmission because the virus can live on those commonly touched surfaces for several hours. Lastly, to limit the spread of the virus, it is important to avoid contact with any symptomatic person during the peak seasons, during outbreak within your areas. Um, Encourage people to stay within their homes if they are not well, and also seek medical attention if needed, if necessary, to prevent the spread of this disease or the virus in schools, workplaces, healthcare settings, etc. And it is also important to avoid crowded places. Specifically, it is important for all those people who are more susceptible to this disease. As I mentioned, there is till now there is no specific vaccine available or antiviral treatment available for HMPV. So, such general public health interventions can greatly help us reduce the disease spread and its severity. So, basically, emphasizing hand hygiene, social distancing, using disinfectants at homes for infection control, educating each other, all can help us to safeguard vulnerable groups like children. So, as public health professionals, it is our duty to inform people about all these general precautions that they can take on their own. They can follow these standard and common precautions within their homes to prevent the disease. However, we also need continued research on the vaccine and antiviral therapies, which is critical for future prevention and management of HMPV related illnesses. Thank you.